Welcome to Senior Aspects with your host, Ann Severs. Each week, Ann will talk about the issues that affect the 50 and older community. So grab a cocktail and hang out with Ann. After all, the kids aren't around anymore to spoil the fun.
Hello and welcome to Senior Aspects. I'm your host, Ann Severs, and my guest today is Arnie Fulmer. I want everybody to meet Arnie, who is the man when it comes to Medicare. He is the best in the biz as far as I'm concerned. I think they will agree. Arnie, tell us a little bit about yourself, who you are, where you grew up, and how you became the Medicare man.
The Medicare man, that's funny. Well, I was born and raised in New Jersey. Spent a long time there, 25 years. After I got out of college, met my wife she's from Chicago, moved there to Chicago. We were there for 12 years. My father passed away suddenly. My mom wanted to live in Vegas, so I left the family behind for 6 months and moved to Las Vegas.
Wow.
And I've been in the sales industry for 40 years. Probably not a traditional sales type of person because I'm all about who I'm in front of, and it's really not about me. So I found Medicare about 8 years ago, and I had, it's a funny story, I was at a network mixer, and it went after the housing market crashed, and I was talking to a guy, and he said, "I'm just curious what you do," and he says, "Oh, I work for Humana." I said, "Really? Well, what's Humana? What's Humana do?" He says, "Oh, we do Medicare." I says, "Oh, great." I says, "You got agents that work with you?" He says, "Yeah." I said, "How are they doing?" He says, "Oh, they make multiple six figures." I said, "When can I start?" I said, "Well, I don't have anybody that leaves." And so I happened to be licensed at the time, and he said, "Yeah, look into the Medicare field. It's a great business. You're out helping people. It's really not about selling. It's really about sharing information and being able to teach them how to navigate the system well." So the first ad I pick up from a thing called Craigslist, which I've never looked at ever before. And in Craigslist, the first ad I see is from some guy from California, says an ad about come get the Medicare. So I pick up that ad, I call him, takes me 3 days for him to call me back. He says, "Here, I can't teach you anything here. Just go out and see this lady down at United Healthcare." I started in the middle of a thing called the annual election period. I think it was November 11th or 12th, and I helped somebody with the 17th. I had no experience whatsoever, which now I understand as a business owner with somewhere around 50 agents, that I understand what it feels like to be in their shoes, because in the Medicare field, I shouldn't say nobody, very few are really helping the agent at that level. So what does that mean to consumer? It means the consumer is not getting the information that they need. Mm-hmm. Agents are reading zeros and not schooled in the areas that are important to folks. So that's how I got into Medicare. I've been in it for 8 years and love what I do.
So what made you prompt you to get your insurance license to begin with? I believe that you did some kind of sales, like appliance sales?
Well, I spent 15 years in the retail industry, selling electronics, TVs, video. At one point, I was the number one Sony agent in the country. They flew us out to the Super Bowl and
fun.
Just sold some nice stories about product, and I couldn't stand any longer. Killed my ankles, and I ran several stores, mostly in Chicago, and I came out here and started with a company, not even in the business anymore, and I worked there for a year, and then I ended up getting into my sales manager left to get into telecom, and we were selling high-speed internet, or it was DSL at the time, and then we went to T1 services, and then phone lines, and I finished up with my career with Cox. I worked a couple of years with Cox and said, I just have a challenging time working for, a big business.
Yeah, me too. So you were doing that, and then that's what you said. You just woke up one day and said, "I'm going to get my insurance license."
Yeah, I just woke up and I had talked to some people in the insurance industry, and I think it was health insurance at the time. So I said, "Hey, let me look down and do this." I went out and studied for a month and got my license, and then used the first one. Didn't know they lasted 3 years. So I ended up going back and I did it again, and I didn't have anything planned at the time. And I just happened to run across a guy that I was out in a mixer with, and we were gabbing, and he says, this is a field that you may want to look at. And I explored it, and I can tell you what my statement was after spending 2 weeks in this annual election. I said, this is the easiest thing I've ever done in my life. Helping people navigate a system is pretty exciting. And
it is.
To this day, I've teared up in a few homes coming out because somebody may be living on $1,400 a month, and a lot of that's going out to drugs, and some of that's going in the home. And when you save them $200 or $300 a month, they're going to Disney World. So it's pretty exciting.
Well, they get to eat that month, which is a good thing. They get to eat.
They may be able to pay for the prescriptions because there's times that they can't.
Well, yeah, that's another thing. Last night I had, so I've also, with Arnie with insurance, I've been licensed for 6 years now, and 6 years. And he's always wanted me to come with him, and I just never did. It was one of those things when I first started getting into the insurance business, I had a little bit of a bad taste in my mouth, I think because of where I was trained. Mm-hmm. But last night, I know a friend who's P&C licensed, life licensed, and she reaches out to me last night out of the blue. And she wants, there it is. So she reaches out to me last night and says, would you be interested in talking to my company, basically doing, I think she's in training, but she's very seasoned in insurance. Mm-hmm. And I said to her, I'm not really for sure. I said, you should maybe think about getting into Medicare. It's a really good little business. And she goes, I just find that so hard. Mm-hmm. And I'm thinking to myself, you find that hard, but you're calling me to try to sell me a term policy right now? Like to me, that's
more
hard.
Complex.
It's way more complex. And so it was just, I guess there's different strokes for different folks. People like to do Medicare. Some people like to do the life insurance part of it. But I think the Medicare industry is, that's why I love working with you, because you're so good at what you do and you give good information, because there's a lot of agents out there that are not trained properly.
Well, the challenge out there is that they teach basic Medicare 101, but you can't teach the interpersonal skills, which is, I was talking to my partner Alberto, and we were talking about this and saying, listen, you can go blah 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 and say, here's what a Medicare 101 looks like, here's part A, here's part B, here's what it means, here's what it does, but what you're not doing is putting them in that picture. So for an example, somebody's on original Medicare, which is just strictly part A, part B, and they have a stent put in. That stent's $100,000 surgery. If they haven't picked up a supplement or a Medicare Advantage type of program to offset those cards, Medicare's only paying 80%. Mm-hmm. So at $100,000 surgery, you're coming out of pocket $20,000. Plus you're coming out of pocket for an A and B deductible, another $1,500. How many folks can afford to dish out $20,000 to have a stent put in? What happens if you need two?
Well, especially if they're only making the minimum amount, $1,400 a month, which some couples make literally only $1,400 a month.
Absolutely. So the challenge in the industry, and this is why there's a lot of agents out there that are selling a product. This is not a business that you sell. And people are already standoffish because they don't want to be sold. We're bombarded on the phone. We're bombarded on TV. We're bombarded on advertising. You get Joe Namath on TV talking about a product that's in one county in Miami and leading these people down the wrong path. Because one of the things he speaks about, and I'm getting off the beaten path here, but one of the things he speaks about is, you can qualify for this thing called extra help. Call us, or you'll save your $148.50. You could save that. All they're looking for is a phone call here. But that brings up a strong point. In the Medicare industry, a third of the people in the country today qualify for a thing called extra help. And what that means is they'll get their Part B. A lot of this will get their Part B paid for. That $148.50 is a big difference to a lot of folks. That's what they're doing. They're teasing you with that to call, but your income has to be at a certain level to be able to qualify for it. And a third of the people in the country qualifying for it don't know it.
Well, that you got two things going on, and then you see this famous football player, and everybody, they trust him, they like him, and then it makes us look bad because they're getting misinformed, and we're the ones that's got to tell them, well, there's only a certain percentage that qualify for these programs.
That's right. They think everybody's going to do it. In fact, I went through a presentation the other day. I did a one-on-one with the folks, and I sat down with a woman, and the first thing she asked is, do I qualify for any of those type of things? So I have to look at her income, right? So there's all sorts of difference. I'm not going to talk about that today. It's, Social Security. We can Google extra help and do it right online, which everybody should set up their own SSA account, Social Security account. It takes 10 minutes. You can go in and see if you're retiring, you can go in and see what you're going to make at 65, 66 or 67 or 68 and see all these things.
Well, and they should do it for a number of reasons. Not only for that, but they should do it because my husband keeps track of his all the time. And he's had to call several times over the years to get his amounts corrected.
Right.
So people do not pay attention to some of those things, and I think they should.
Well, it's not that they don't pay attention. It's just that most people don't understand
Or they don't
that
understand
it exists. So the same thing falls into the Medicare field. What we don't know, and we all know this cliche, what we don't know can hurt us big time.
Yes.
And there's so much to Medicare, and why a lot of the agents think it's complex is because they're teaching what's being taught as Medicare 101, which is fine, and they're reading in this market, they're reading a lot of zeros. That's a value proposition for somebody who's seen it for the first time, but if they don't know how to use that, if they don't know how to take advantage of the process, or they don't know how to maneuver around the complexity of Medicare, then that's it. And most of these agents aren't taught that. That's why a lot of them will say, well, I can't figure out how to do that. One of the things we do here is, because of the size of our agency, it's not a large one, but we're a small agency here. I answer the phone and people call and say, here's what my situation is. How do I handle it? I can't teach you all that stuff. There's just too much. It takes years to learn all that. I'm fortunate. I learned the business from a guy who was in Medicare for only 50 some years. I took the notes, I memorized it, and then I started to teach it. Once we started to teach it, now it's second nature. And once it's second nature, to me, I can teach it to an agent. But the thing that I find with the agents today is they're not going to learn it until they're in that situation where somebody says, well, can I save money? My friend saves money on Part B premium. How can I do that? If you don't know what those numbers are, you really can't help them. But the nice thing is my agents pick up the phone. Some of them here 7 or 8 years, of course, they know that. But they'll pick up the phone and say, hey, Arnie, here's the situation I have. How do I handle it? It takes me 2 minutes. So I learn a lot, obviously, because there's a lot of crazy stuff out there. Yeah. But learning Medicare from an agent standpoint is not difficult if you have somebody that answers the phone. The challenge is a lot of these sales managers don't do that. They're too important for that. So that's what I see as the value proposition for the folks that we work with. So. Yeah,
that's one thing you do always answer the phone, or I know he's always going to get back with me whenever I call, because he understands that when we're sitting, when we're calling him, and he knows what our schedule is for the most part. He knows if we're going to go on an appointment, so he always makes sure he calls us back so we can get the answer and help the client the best that we can.
That's correct.
Yes. So give the folks just a little bit about Medicare. Like, what is Medicare? Just give them the very basics for those that maybe don't really understand Medicare.
There's a lot of things that they need to know. But so when we've worked for 40 quarters or 10 years and paid into Social Security in the United States, we automatically qualify for Part A. So we get Part A. What that is hospital inpatient. It's more in detail than that, but they get that. So here's what most of them don't know. If you collect Social Security early, 62, a lot of folks do it at 62, you'll automatically have Part A and Part B will sent to you from Social Security. But if you don't collect Social Security early, 3 months before you turn 65, you definitely want to get Part A if you're still on a group employer plan. So you just need to contact Social Security. If you're still on a group employer, what they call credible coverage today, then essentially what you don't have to get your Part B. So you don't want to get your Part B if you have group coverage unless you see or want to look at a Medicare Advantage plan that may make more sense to you financially. But if you're retiring at that time, then you want to make sure you get your Part B. Part B is the doctor and outpatient. Together, those two things are called Original Medicare, which means Medicare covers 80% of what you're doing. As long as it's a thing. Everybody needs to know what medically necessary means. It means the doctor says, I have to have this. Mm-hmm. And once it's medically necessary, then you're fine. So that's really the first option, where a third of the country sits on what they call private fee-for-service or Original Medicare. So that can be a very, very dangerous situation.
So why is it so important for someone to call Social Security when they turn 65 to get their Part B? What happens if they don't go through the steps that they need to? If they're not educated, if they don't know What happens?
If they come off of a group plan, let's just say if they're 65 and they don't pick up their Part B, and they don't pick up their Part D, which is their drug
Yes.
plan, you can be penalized. You can be penalized if your income is over what they call the low income or extra help level. What you can basically do is, if you don't pick up Part B when you come off of that group, and you go 12 months without that, you can be charged a 10% penalty. Okay? But the prescription drug one comes off, and it could be 6. I think you've got 3 months. You got a 3-month window with that. But with the prescription drug plan, like my mom never picked up hers. When she does, she now pays about $40 a month. Because when I put her on when she got on Medicare, it didn't exist and nobody contacted her. She goes, "Well, I'm never sick. Why should I get a prescription drug plan?" You could be charged.
We hear that a lot too. I'm
Be charged
never
a large
sick.
penalty.
Yeah.
1% of the average.
Is that for life, or does that?
It's lifetime.
It's a lifetime. So it's key to ask those certain questions. That's why it's key to meet with somebody like Arnie to go over these things. And that's exactly how he speaks to the client. Like, he wants them to understand this so that they're not penalized unnecessarily for the rest of their life, basically, is what it amounts to.
If I can give one value proposition to everybody that listens to this, I would tell you this. If I have an agent from one company who's coming in and they're selling a product, I won't mention companies, or I have somebody with another company, they're selling a product, but the brokers generally work for you. They're not working for, one of the big players that are out there in the marketplace today. But the takeaway that I want you to know is, listen, the most important thing you do is get on the right plan. But how do you do that? You have to make sure, don't take that first person that comes in and goes, blah, 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 here's what this plan looks like. It may look great to you in the beginning, but it may not be the right plan for you. Now, like I said, there's a good 10% of the agents that know what they're doing out there. But most important thing that you should be concerned with is having somebody that really carries the products, or the array of products. They can do not only a Medicare supplement, but also the Medicare Advantage plans, and can talk about both of those, tell you what your options are, and then give you an idea of what's on the marketplace. The prescription drug plan, for somebody who's on 8 or 9 drugs, they want to look at that first. I know seniors look at doctors first. So they want to make sure that they carry a plan that fits your doctor if they're in love with your doctor. Mm-hmm. But sometimes with some of the lower cost plans today, I mean, they're designed to help you save money and keep you healthy. And that's very important in today's market. So my advice is, find somebody who's strong, who really understands Medicare. If you have an agent that tells you, hey, day 1 through 20 in skilled nursing is 0, you want to question that, because they're telling you half-truth. Because skilled nursing, what does skilled nursing mean? Ask them, what's skilled nursing mean? Mm-hmm. Well, skilled nursing means if I'm laying down there and I'm wired up, I need 24/7 service. But if I'm rehabbing in a skilled nursing facility, and I'm there doing it for 2 weeks, and my physical therapist says they're doing a really great job, I'm going to cut you down to 3 days a week. You have to say no, because here's what's important, and here's what the agent's not telling you, is that I just changed the language. If I go to 3 days a week, I just changed the language from skilled to intermediate care. Guess who gets the privilege of paying for intermediate care the rest of the way?
The patient.
You do.
Yeah, I wonder if that's what my mom ended up doing when she was in rehab, because she was refusing rehab. And I, at the time, was a very green agent. I was a greenhorn, and I didn't know that. Mm-hmm.
Well, if they're on a Medicare supplement or a Medigap program today, and this comes out in your Medicare and U book, and I know the seniors get it every year. I'm a senior, so just got mine sitting here, as a matter of fact. You want to know one thing. There's a thing called under observation today, which is going around. They're trying to get rid of this, but the hospitals like to protect themselves. So if I'm on a Medicare supplement, and I go into the hospital, and I know that I'm probably going to have to rehab after that, coding is critical for them, because if the hospital codes me as under observation, that means outpatient. Okay, if I'm coded under outpatient and I have to rehab, okay, I now have to foot the full bill for rehab.
You hear that?
The hospital protecting themselves.
Yes. You
can combat that. If you have any questions, you can give us a call. But I will tell you, they need to code you as an inpatient. You have to be there 3 days, released on the 4th day. to qualify for the rehab. And I don't care if you have TRICARE for Life or any of the programs that are really a supplemental program. Medicare Advantage is Medicare, but a supplement is a supplement program. If you have that, make sure it's important. I'll tell you one of my agents, first thing that he's done is essentially had his roommate go up on top of a church to clean out the gutters. He passed out as he stood up, fell down, broke both hips.
Oh.
Took him to the hospital. In the hospital, John, which is my agent, he went right to the front desk and said, "How is my buddy being coded?" And he says, "Is he going to be under observation or inpatient?" No, he's an inpatient. He's protected. So have a loved one make sure that they go and say, "Hey, listen, I want to make sure I'm coded the right way." And these things are true in some of the Medicare Advantage plans.
And we don't mean code blue either.
Yes, yeah.
We mean coded in the medical terminology is what we're discussing.
So coding is important to understand. If your agents are not talking to you about these things, then find somebody that's educated on there. I don't care how much you like them. I know a lot of us buy from friends. But coding is important. And some of these, you'll see some copays on some of these products today. Maybe run from $80 to $100, but the doctor controls a lot of that. So some of these, if I'm doing an MRI, it could be a zero copay, but some of them could be $100 copay. I'm just using fictitious numbers right now, but so you've got to understand that that's controlled by the doctors and controlled by that group. So these are things that until you run across those, are not important to you. But I'm going to tell you, knowledge is power, and knowledge could save you a lot of money. So there are things that your agents should be talking to you about, and if they're not, then you need to understand that. Let's find somebody that really understands Medicare as the picture. They're not there to sell a product.
May I see that book for just a moment, Arnie? I want to show everybody. So Arnie just turned 65. He turned 65 at the beginning of the month. I have a friend who turned 85 today, Arnie. Oh. And this is the book that when you turn 85, you get this in the mail. And it's a really good book. It's a little long, some of it, but it's got like the highlighted blue, which it's basically it's like a, how do we put it in school? Like almost like a dictionary to where when it's got the highlighted blue, it'll explain to you what that means. So this is a good book for seniors to definitely, once they turn 65, to maybe take a look at it. And it seems like it's pretty easy to read. It's got like the letters are bigger. I'm sure they did that on purpose. But Arnie, I know, does have educational events around town. We're in the process right now of booking a few different places so that we can help as many seniors as we can. Mm-hmm. So how would people get a hold of you, Arnie?
Well, they could call me on the business line, or they can call you directly also. So okay. My business line is 702-820-3133.
Yeah, and we'll have all of that displayed once we do the video, so you'll be able to get a hold of Arnie. We'll have a link to Arnie's website, maybe a link to your Facebook page, so folks know how to get a hold of you. And if you are part of a community that maybe that could benefit from Arnie's knowledge, reach out to him or I, and we will set it up to where we come and visit your location to maybe help some fellow seniors, just give them just the basic information. This is not a sales presentation. No. It's basically a basic 101 presentation. It's an overview of Medicare, and then generally the way that I like to do it is I like to sit down and chat with people for a couple minutes to answer their questions. On educational events, we really can't talk about products. We can talk about things that you ask us, but we're here to assist you, and if you have questions, you can give us a call. I've got several agents that are highly skilled. I've got folks that we're a very big Latino market also, and we've got people that can help you pretty much, Chinese, Vietnamese. I've got agents that can help you. If your English is not strong, I'm not sure if that's all listening, at this podcast, but I will tell you that it's important for you, with the largest decision that you have to make the right choices. And again, I can't get into costs or any of those things with some of these products, but be more than happy to answer your questions. I can do that over the telephone, or we can set up an appointment, or you can come see us at one of our educational events. We do quite a few of them around the marketplace. So, yeah, and if you are an agent already and maybe been thinking about getting into the Medicare industry, I cannot stress to you more that this is the man that trains and trains very, very well. He's always there for us. He is just an amazing source for Medicare. So if there's something you've been thinking about getting into the business, please give Arnie a call. We're creating a whole academy for the new agents to come in so they can learn. We just want to make things easy for everybody, all across the board. Is there anything you would like to add before we sign off today, Arnie?
Nope, I'm just pretty much just saying what is a value proposition to you. What is it? Look at the drugs. I know doctors are important to you. There are products out there that may have your doctor in them that people that are selling a product may not carry. So look around, ask questions, create value for yourself. And my biggest advice is find somebody that knows what they're talking about.
For sure.
Muy importante.
Well, and I gotta let's wish Arnie a happy 65th birthday. He just celebrated his birthday over the weekend.
Friday.
65. Yeah. He's finally got Medicare. So I would like to thank Arnie Fulmer. I thank you so much for being here today, Arnie. To learn more about this show, visit our website at senioraspects.com or allaspectsradio.com. So until next week, this is Ann Severs reminding you to stay young because the best years are ahead of you. Thank you.
Thank you all.
Thank you for listening to Senior Aspects, where each week we talk about the issues that affect our world. For more information about this show, please go to senioraspects.com or allaspectsradionetwork.com. Thank you and have a fabulous senior week.